Facelift facts. Hi there, it's Dr. Andrew Cohen, board certified plastic surgeon in Los Angeles. Surgery time for a facelift can really vary. It's usually about 4 or 5 hours if I'm just doing the lower face and neck with a deep plane. If we're adding the eyes or laser or brow, could take 6 or 7. It all depends on what we're doing. There's so much involved with a facelift that it's very difficult for me to describe on a 1-minute video here on TikTok or Instagram, but it involves making an incision in front and behind the ear, elevating up the skin and tightening up the deeper plane called the symas or the fascia. That's where the tension is on the deeper plane, and then the skin is redraped in a higher location. The types of facelifts, I can talk for about 2 hours, but it's always a question. There's a mini facelift where you'll be mini happy. There's a full facelift where you'll be full happy. Okay. However, I have had 1 or 2 patients that ask for a mini facelift where we make an incision from here to here and just dissect underneath the skin and just pull the skin up a little bit. It's going to give you a mini result. But you know, it takes a lot to do a lower facelift. You have to tighten up the deeper tissues and do a deep plane and then redrape the skin. So there are mini facelifts. I'm not a real big fan of those because I don't see enough of a result. But once in a while, a patient is a candidate for it. At least 2 preoperative appointments for any facelift. We want to see you, go over the plan. The first one is the first consultation and then the pre-op visit. There's lots of post-op appointments for facelifting. We're going to see you the next day. We're going to take out the little drain. We'll see you a week later to clean up the suture line. I use a lot of dissolvable stitches rather than those that have to be removed. So a lot of my patients are very happy. Like our patients really comfortable. We want to monitor the blood pressure, your heart rate, all that kind of stuff. So I usually put people under full general anesthesia. Recovery time is about a week or 2 for a facelift. I would say about 2 weeks. The ideal candidate for me, I see a lot of patients that are in their mid-50s. That's usually about the time people are starting to think about doing a lower face and neck. I have done someone who is, in their young 40s, but it all depends. If you're looking in the mirror and you're starting to see some facial aging of the jowls and extra skin, that all can be tightened up with surgery. There's really no machines right now that take the place of surgery. Surgery is really the best option for most people. Facelift can last 8 to 10 years. That's really what the studies have shown, that after surgery, it usually should last about 8 to 10 years. But weight loss, weight gain, smoking, stress, anything can affect the structures of your face and make it fall a little bit faster. So you want to try to maintain a good weight and not gain or lose weight after a facelift. Thanks so much for watching.